Hi everyone, I'm Dr. Heidi from One Agora Integrative Health, and I just wanted to come on today to talk about the pelvic floor. Pelvic floor oftentimes gets forgotten about, especially when we're talking about things like unexplained low back pain and weak core muscles. So I just want to show you guys a little bit about what it looks like and some of the muscles and where they're located. So here is our pelvis. Everybody has a pelvis just like this. They're all shaped a little bit differently. And we have some organs inside our pelvic bowl here. So on a normal day, they're not coming out like this, but women have a uterus that our pelvic floor is holding up, and everyone has a bladder and rectum that the pelvic floor muscles are holding up. These are our pelvic floor muscles right here. So they honestly just form like a sling around these muscles. But over time, due to things like age, trauma, and especially childbirth in women, these muscles can get very stretched out and very weak. So they don't do a very good job of holding in these organs. So sometimes some of the more well-known symptoms are going to be incontinence and just a general weak feeling in our pelvic floor. But some lesser known symptoms, like I stated before, are going to be that unexplained low back pain and some of that weak core, because we actually have to engage our pelvic floor before we can even engage our core muscles. So this is the inside. And then on the outside or the bottom, it's the pelvic floor is still here holding in those organs, but they're connected back here to the tailbone. And then there's other muscles and ligaments that carry this all the way up to that low back. So you can see where that would come in. And especially if you've ever had any type of injury to your tailbone, like a fall, especially here in Minnesota, skiing, snowboarding, falling on the ice, things like that, any type of trauma can affect those muscles and those nerves and then cause some of that low back pain and that weak core. So today I'm just going to show you a few things you can do at home to evaluate your pelvic floor to see if it might be weak, to see if your pelvic floor might be causing some of that low back pain. And those are easy things, and we do have some treatment options here at our office that can help with that weakness. All right, everyone, here I'm going to show you a few at-home tricks you can do to see if you potentially have a weak pelvic floor. Hannah's going to help me, and you may want to get another person to help you out at home as well. So the first thing we're going to test is how you can do a sit-up. We're going to have you lay flat on your back. This can be on the floor or anywhere. And have your knees up like this. And we're going to have someone hold your feet here. So I'm going to ask Hannah to cross her arms in front of her like so and do a sit-up for me. And if you could come all the way up like that on your own, that's wonderful without moving your feet. That indicates you have a stronger core. So now, Hannah, if you can come up and you can't make it up at all, that indicates your core is not contracting and it's not engaging at all to help you do that sit-up. But actually, in order for our core to engage, our pelvic floor has to engage first. So that could be one indicator where you have some weakness in your pelvic floor. Another indicator is going to be the straight leg test here. So put your feet like this, and we're going to have you hold your feet up in the air like this. And I'm just going to push down a little bit and see if you can hold your feet up for me without letting them break. Good. So now if you had a weak pelvic floor, it might look something like this, where I'm trying to push her feet down and they go right down like that. So that also means she has a little bit weaker core and then potentially a weak pelvic floor as well. And then lastly, I'm going to have Hannah get into a plank position. So just your normal average plank from your elbows and up on your toes, nice flat back here. If you can hold this plank position for 30 seconds or longer, that's a good indicator that you have a stronger core that's actually engaging. If you can't do this for 30 seconds, potentially you have some weaknesses that need to be corrected. And I'm going to talk a little bit later on that and the treatment options we have for that weak pelvic floor. All right, so here I am sitting on the Emsella chair. This is one of our best treatment options for a weak pelvic floor. Literally, as you see me sitting here, this is how easy the treatment is. You literally come in, you're fully clothed, it's non-invasive, you sit on the chair, we run the treatment for 28 minutes, and then you're free to go. There's literally no downtime, no pain, and it's very effective for a lot of different issues we see with the weak pelvic floor. There's a magnet actually underneath me here that puts the pulse into the pelvic floor about 10 centimeters. So it's a high intensity focused electromagnetic pulse that will do that for you. And it is kind of a different feeling, but it isn't painful at all in any way. And we found this to be the most effective treatment for the weak pelvic floor. So if you are interested in talking to us about the Emsella, or if you have any concerns about your pelvic floor, or again, any unexplained low back pain, this treatment might be the right thing for you. So you can give us a call at the office or contact us at info@oneagorahealth.com. Thanks so much for watching.